And welcome to the show, everybody. Thanks for joining us. We're going to talk about medicine from a point of view that you might not be too familiar with. Our guest is Dr. Stephen Cusin, and he is a medical advocate. He is somebody that represents the patient. Good to see you, Stephen.
Good to be here, Joe.
You operate a practice, but it's a practice that's not only unique in our area, but I would suspect unique in most of the United States.
It's the only one, at least for now. I'm hoping to get more company. It gets lonely.
Yeah, and it's a shared decision making process that you're involved in. You actually are a patient advocate. Is that the correct way to put it?
That's right. The motto of shared decision making is no decision about me without me. So much of medicine is preference-based, but people don't understand that. They don't realize that they get a choice. They should know their options.
And I know that you have an office in Utica because I walk by it almost every day up on Genesee Street. I forget the number, but it's on South Genesee Street. What is the number, Steve?
2310.
2310. It's above Lourdes, isn't it?
Just above Lourdes.
Yeah, and Lady of Lourdes Church. And it's a program where people at various points in their medical travels can come in and seek guidance, can seek advice, can talk to somebody.
People feel lost. Some feel abandoned. Others feel skeptical. Others understand that there are options that are not presented to them, and this is where they come.
Let me tell you, and you tell me if this is not a good example of how you can help. My grandson tore his ACL just recently, and which is bad enough if you're an athlete to tear your ACL. Went into the hospital to have it repaired, the surgery done. Surgery went fine, but then he got a staph infection, and he had problems with that, some big problems. And so it was very nerve-wracking for his grandfather and his mother and dad and brothers. But we had a little bit of an advantage, and the advantage was there's a doctor in the family. And my daughter and my son-in-law got on the phone to him and said, well, this is what they're doing, this is what they're recommending, this is... And I mean, it was just a lifesaver for us.
Well, that's the other motto of my practice. It's almost like having a doctor in the family. With an ACL, a tear of the ACL, I prefer to see people before they go in for the arthroscopic surgery because not everyone needs it. Some shouldn't have it. The timing of the surgery is very important. Some people want it within a month. Some can wait 7 months. And so, like any medical decision, it's preference-based, and there's a huge spectrum from doing nothing to having major reconstructive surgery. And who's going to do it? Where is it going to be done? And also, I have an in-hospital practice because 25% of people who, like your grandson, have major surgery, 25% get infected, hospital-acquired infections. Staph, if it's a resistant staph, might have been the beginning of a horrible, long course leading to all sorts of terrible debility for a young man. So shared decision-making epitomized by that young man's progress, and the fact that he did well, in no small part, has to do, of course, with a supportive family, but a doctor in the family is just precious.
Well, you know, I mean, just somebody you can pick up the phone and say, geez, you know, this is happening and we're worried about this, and to have an expert on the other end of the line. So with your practice, Stephen, you see people at all points of that, correct?
I see them in the office before they go to the hospital, not to say don't go to the hospital, but to have them make a choice that's consistent with their risk tolerance. Some people don't want to take a risk and do it without knowing it. With their preferences, the trade-offs, the understanding of the risk and benefits, and all the alternatives. Then once in the hospital, if I'm called in, I find it the most gratifying work I do, because the patients there, especially in the ICU where I do most of the work, are terribly sick, and the time for shared decisions is over. Now it's the time to make sure medication errors don't occur, hospital-acquired infections don't occur, psychological trauma, connectedness, bringing the family together into the process, communicating with the doctors, and running interference.
So at that point, you're an advocate.
At that point, I'm an advocate. I run interference. I make sure everything is the way it should be. Medical care in this town is great. I mean, I came here for a reason, and I thrived here for a reason, and my colleagues, I value them. So individually, this is a wonderful town for medicine, but collectively, there are a lot of people who get in trouble in the hospital every single day.
And it's so overwhelming. I was in the hospital, knock on wood, not very often in my life. Once when I had my tonsils out as a young boy, and another time when I had some kidney stones. But everything comes at you fast and furious. And maybe you've been sedated, or maybe you're just not thinking right. And boy, oh boy, it comes fast and heavy.
There's no point in your life when you're hospitalized where making a decision is so important, where seconds count, when at the same time you're the least able to do it. You're too stricken, you're sedated, your family is paralyzed with fear, full of emotion. It's a hot situation where good decisions are rare. And to rely on strangers whose skills have to be considered uncertain, they may be terrific, but you don't know that, is a very dangerous way to go. And to have someone they trust who has a platform, the book for me is my platform, 30 years in town here, and who has no bias as regards profit. I'm not working for the hospital, and I'm not working for the insurance companies. So it's a better system for those who need it.
In fact, when we come back from our first break, I'm going to ask you about your book. But some of your background, people should know what your background is. Before you got into medical advocacy and shared decisions, you were a practicing physician.
Oh, for 30 years. I came here in '81.
From New York City, right?
From New York City. And I still have a place in New York City, but I rarely go back there. This is where I live. I love Clinton. I love Central New York. That's part of the book, the first chapter. And I started digestive disease medicine, which is still going strong today, 60 people strong, and lovely guys, a good practice.
One of the things that I've often wondered is, it's time to go get a doctor, or it's time to go get a dentist. And that's an interesting process, isn't it? I remember I needed a dentist years ago, and I asked somebody, and I don't know that that's the best way to do it. I mean, maybe they had a good experience, but you know, how do you pick a dentist? How do you pick a doctor?
Not by an anecdote. Yes, it's important to ask your friends, and you can't rule out word of mouth. It's very important, but ultimately, you're making a very important choice, and it's one that requires knowledge and background. The book goes into a great amount of detail, because when you're hiring a doctor, especially a specialist or a subspecialist or a surgeon, you're hiring brains, you're hiring skill. It's nice to have communication and empathy, but you really have to find the smart doctors, those who are up to the challenges of the complexity of medicine today. And your next door neighbor may have had a good experience, but by really understanding the spectrum of that doctor's ability, you're going to benefit from that much more.
You know, I'll tell you how I think I can get misled sometimes, and not just with medicine, but in other aspects of hiring professionals, is that somebody's bedside manner means such a great deal to me. I mean, they might be incompetent, but...
That's the point.
But, you know, they get along so well with me, and I like their personality, and maybe I'm overlooking things.
People who are satisfied with their care are not necessarily getting the best care. And several articles came out in the last couple of months suggesting even more. The people who are happiest with their care are getting the worst care because they're getting what they want, what they ask for, which is a bad idea, or they're getting the fruits of their insurance policy. They have a great medical insurance policy. Their doctors love to see a well-insured patient. No one's paying attention. And so being happy with your doctor is not necessarily being safe with your doctor.
All right, when we come back, we're going to talk a little bit about the book, too. Doctor, your patient will see you now. That sends a message just in the title. Dr. Stephen Cusin is our guest. We'll be right back. And welcome back, everybody. The Doctor, Your Patient Will See You Now by Dr. Stephen Cusin is the name of the book. And where can people get that book?
Anywhere online.
Okay.
Kindle, e-books, hardcover.
All right. And am I correct that you were trying to send a message with the title, Doctor, Your Patient Will See You Now? Maybe we forget who is the boss in this relationship.
Shared decision-making is that patients are not partners in their care. Patients should be managers of their care. And to have a shared decision, you have to have valid opinions. The book offers the ability to find resources that allow patients not to do a Google search, but a real medical search which really empowers them. Everyone talks about empowerment. Empowered to do what? Be your own advocate. To whom? What are you going to say when you're advocating? You have to have tools. The book hopefully provides some of those tools. So does my blog.
One of the, in fact, I was reading your blog. It's very interesting, very well written. And the subtitle of the book, Gaining the Upper Hand in Your Medical Care, goes on to make that point as well. One of the things that I find when I go to the doctor's office, knock on wood, I don't have to go very often, and usually the results are successful, but I'm often thinking before I go in, what do I want to ask the doctor? And I'll write myself some notes, because you get in there.
You read the chapter.
And you get in there, and you get kibitzing, and all of a sudden you forget.
That 12 minutes goes by fast.
Yeah, well, I guess I'm fortunate because the doctors that, maybe it's because I engage them in conversation, I don't know. But
That's because you're Joe Kelley.
Well, I don't know. But
I got better care because I'm a physician.
Yeah, yeah.
And you get better care because you're well known. You're a public figure.
They probably don't want me to die in their watch, is what you're saying.
Damn right.
But in any event, I write down notes to myself so that when I get in there, you got a limited amount of time, and you want to make sure. I want to make sure that my questions get answered. That a good idea? Should I be doing anything else?
It's a great idea because unvoiced needs are very common. Patients don't talk about what bothers them the most. And sometimes those are the chronic nagging problems that doctors think about and worry about the least.
Yeah.
And so if you hand in a paper and saying, these are my goals for today, sometimes you walk out with a prescription and you didn't even want one, or a test that you didn't require, simply because your agenda wasn't voiced. And some things are very embarrassing and we don't like to talk about them, but it's easier to write it down and let the doctor read about it.
It's, I mean, it's an unfair relationship, really, when you think about it, a patient, and then you've got the doctor. His or her education is so much greater than ours. Their job is such a big job, their response. And, we look up to people in your profession, and I think sometimes, many times, that's very intimidating for us.
Patients are literally looking up because doctors stand over them, glasses down, and patients prone in their paper pajamas. And so not only is there an inequality that's socially placed, there's also a physical inequality. Doctors should sit down and be on eye level with you. And if they're to call me Dr. Cusin, I call them by their last names. And it's only by mutual permission that we call each other by our first names. I think it's terrible for me to call, hey, Joey, and you call me Dr. Cusin. That's what cops do. That's what the IRS does. So I believe in Mr. Kelley and Dr. Cusin unless it's otherwise arranged between us.
We talked about preparing to go to the doctors. When you're in the office with the doctor, if you feel as if, and I guess this is not the easiest thing in the world to do. I mean, if the doctor's hurrying because you got to get to the hospital or he's got a whole office full of patients, sometimes you feel like you're getting, and I should point out that I'm very fortunate because I always feel when I'm at my family doctor, he's got all the time in the world. If I want to sit there and talk and ask, he never seems to rush me, but I'm sure that isn't always the case.
It's not always the case. It's 12 minutes. And you can tell your doctor that your needs aren't being met. If your doctor has something going on in the hospital, well, there'll always be times when more acute needs may supersede yours, but that should be not the rule. That should be the exception. Most of the time you have a scheduled appointment. If you have 12 or 15 minutes, you should maximize it. If your doctor's not seeing to your agenda, you don't understand your doctor's speaking above you, bring the doctor down a few levels. Doc, and that's, again, always the thing I say, first the tickle, then the slap. I like you, I trust you, I need you, but you're going too fast. I don't understand what you're saying. I don't want to talk about this today, I want to talk about that today. Good doctors will understand this. They won't be bitter. They'll become better. Better patients make better doctors. And if your doctor turns unpleasant or seems to brush you off, time to look.
When you anticipated my next question, when or what goes into the decision making that said, this isn't working out with this doctor?
Doctors have a halo effect. You'd sooner lose your rabbi or minister or priest than your doctor because they're endowed with this kind of power that's not really true. I think if your doctor doesn't respect you, doesn't give you a fair hearing, gives you profoundly incorrect information when you go look at your own resources, humor, bad humor, taking advantage of your situation, extremely common. Dense apathy, nil communications. There are certain things that are deal breakers. And with those deal breakers, if you're healthy, you're inconvenienced. If you're sick, you get dead. And so it's when you're healthy you have to make these decisions and make the right decisions and not tolerate bad behavior. What you wouldn't tolerate in a travel agent for a trip that you're going to take, people tolerate in a doctor whose decisions may change the arc of the rest of their lives. Medical consumerism in this country is terrible. And people just don't make the hard decisions because they feel incapable of it. They think of medicine as some sort of impermeable wall that they can't pierce. Intergalactic travel and its complexity, it's not. People can get a real handle on their care.
I remember one time, I don't know how this fits into the conversation, but I'll tell you the story anyway. I had a procedure done on, this is years and years ago, and there was 2 doctors in this practice, and I kept going back and going back and going back, and it wasn't getting any better. And finally, there was a disagreement amongst us, and the other doctor in the practice called me, and I said, well, this is what's going on. And he just said, well, you know, that shouldn't have been going on, and I'd like you to go see, you know, me or somebody else, but all those other visits were, you know, you're not going to be charged for that. That was, and it just stemmed from the conversation. I mean, we had a conversation, me and the other doctor. The first doctor wasn't too open to conversation, but the second one was.
Everyone's entitled to their own opinions, but no one's entitled to their own facts. Sometimes there are factual differences that are sufficiently severe that demands you move on. Other times there's simply difference of opinions. There's so many ways to deal with a given problem. There's so many ways to say your high blood pressure is treatable or shouldn't be treated. Your sugar is worth treating or not treating. There are many opinions. You pick the one that you're most comfortable with the doctor you're most comfortable with, who will give you a fair hearing.
Yeah. You know, one of the other, you know, you hear doctors say this all the time. Well, you know, you're entitled to a second opinion, but it's almost like when you say, well, I'd like to get another opinion, it's like, I feel as if you're like insulting them.
No, I don't think so. When people come to the Shared Decision Center, the other motto of our group is, it's not a second opinion, it's a place where you learn to understand the first opinion. And I think doctors don't like it in this town. I'm new to this field, not to the area, and doctors are a little bit iffy on it. But good doctors would encourage a second opinion if for no other reason. If you get a second opinion and the opinion agrees with yours and the patient comes back to you, that doctor is relatively immune from a malpractice action because the patient got informed consent, which is true when they come to me as well. So doctors should encourage second opinions, and more important from the patient's point of view, for elective surgery, which most surgery is, and for cancer, any cancer, there's always the need, always, to get more input, because one person's opinion on something that important is simply not enough in a world that's so complex.
Is there a way for the patient to broach that to the doctor?
Yeah, the tickle and the slap. You know how much I rely on you, you know how much I like you, but this is a really tough decision. This is a bad diagnosis. And I really like what you told me, and you know I rely on you, but I'm sure you're going to understand when I ask you if it's okay for me to go and get another opinion on this.
Okay.
A good doctor will say yes, we'll encourage it.
Dr. Stephen Cusin is our guest. We're going to be talking with him more after this break, and we'll get you the website where you can go to and read some of the good doctor's blog. He writes a blog which is very good. Stay with us. We'll be right back. And welcome back, everybody. Thanks for staying with us. Stephen Cusin's our guest. He is the author of that book, and it is available online. Doctor, your patient will see you now. And one of the things that happens with anytime you get into a medical situation is that the time is not on the doctor's side. The time is on, I got that backwards. The time is not on the the patient side. They have to give their time up to the doctor. And I can understand that. I mean, doctors are trying to see a lot of patients, do a lot of different things. But when do we have, say, well, that's it. You know, a friend of mine was at the doctor's once, and this appointment was at 2:30. It was 3:15, and they still hadn't gone in, and she said, that's it, and I left.
Doctors run late because they don't have control over their schedules. Mm-hmm. Someone calls, sure, the secretary will lump them and dump them. They put them in the schedule, they dump them on the doctor, and the doctor doesn't get what they've requested out of their day, a certain number of patients. I spent, I'd say, 20% of my day apologizing to people, and I feel if an apology is made and an excuse given, mm-hmm. and it's not chronic, that it should be accepted on me. The patients hopefully will accept that. They always have from me. Yeah. I'm sorry I'm late. I hope I didn't inconvenience you too much. Let's get going.
You know, when I go to the doctor now, I notice that there's, and this has been the case for a while, you sign in and you put in the time you arrived, and then you put in the time of your appointment, and I guess they're trying to do the best they can with the delays and things.
It's so hard. Mm-hmm. The doctor's day is fractured by so many phone calls from hospitals, pharmacies, labs, nursing, colleagues who have a problem, referrals. It's almost impossible to stay on time. Some doctors deliberately leave huge holes in their schedule so as to prevent this chronic lateness. Others don't even make schedules anymore. They just walk in with an open panel, and there are enough patients to fill the day and not be late at the same time.
You, this is a quote from, I forget if I got this out of your book or off of your blog, but this quote caught my attention. Local equals good. A local choice is the only choice. The local experts are the only experts. Expand on that.
Well, that's a bias. I think that people should seek care locally first. Familiar doctors, family, familiar sites, opening up the OD and turning on UTR. These anchor you to home, and the care is good. And in some cases, in local care, and the book goes into it in detail, I don't mention Utica hospitals because I live and eat here, but I mentioned Rome Memorial. And in some metrics on report cards, it's better than Duke, better than NYU, and better than Columbia. Mm-hmm. Local hospitals are the default place. They're a landing pad. They could be a launching pad to regional or national centers, but staying local is a good idea. There is a bias, however, amongst doctors that if it's not local, it doesn't exist. That's a problem. Habit, bias, geographic bias. This is what we do here in central New York. That's not necessarily what might happen 200 miles south, 300 miles west. We're in the middle of a huge medical metropolis, and it's a wonderful opportunity for central New Yorkers who will occasionally need that referral to a national center.
WFXV, Fox 33, you appear on there at 10 o'clock on Monday nights.
Medical advocate. It's such a strange thing to have gone through these phases of career. You've gone through so many phases.
I have, yeah. Are you enjoying that?
I'm loving it. It scared me to death, the first live appearance.
And you've got your blog, and if somebody wants to read your blog or look at your website, where do they go for that?
Medicaladvocate.com.
Yeah, and it's, I guess it's up to all. I almost kind of think, Doctor, the bottom line is the burden is on us, the patient. We've got to do things.